Over the past 20 years, research has but revolutionized our understanding of disorders of consciousness, or DOC. We've learned a lot about what these conditions are and how to diagnose them more accurately. Thanks to this research, today there is an exciting landscape of developing therapeutic interventions for these conditions. That is, new ways to enhance recovery and improve patient outcome. That's why the Neurocritical Care Society's Curing Coma Campaign has developed new Common Data Elements, or CDEs, as a structured way to standardize future research in this field. My name is Martin Monti, and together with the other members of the Therapeutic Interventions CDE Working Group, including Rachel Bickman, Norman Spivak, Aurore Thibault, Caroline Schnackers, John White, and Erika Molteni, and our collaborators at the Curing Coma Campaign initiative, we have developed a new set of common data elements aimed specifically at studies evaluating novel interventions for patients with a disorder of consciousness. Now, there are several types of experimental interventions to help restore consciousness in patients who survive severe brain injuries. For example, pharmacological interventions such as amantadine and zolpidem, or device-based electromagnetic neuromodulatory interventions like deep brain stimulation and different forms of transcranial electrical stimulation, or neuromodulatory interventions based on mechanical energy like the rapidly growing field of transcranial focused ultrasound, and different kinds of sensory stimulations like music therapy, among many others. And no doubt, as this video is being recorded, there are many groups worldwide who are pushing the envelope of our science to develop new interventions. Now, the challenge is that until now, studies have used different ways of measuring outcomes, and this makes it hard to compare and aggregate results across studies. This is why the Curing Coma Campaign has decided to create novel CDEs that can be used for all interventional studies in the field of disorders of consciousness. The CDEs for therapeutic interventions are collected in a practical case report form, or CRF, which is freely available on the Zenodo link you see on the screen, and which should be used together with other relevant CDEs, such as General Core, Disease Core, and Basic CDEs, which you can also find at the Zenodo link. This CRF mainly includes supplemental CDEs, which are the CDEs specifically recommended for therapeutic interventions, as well as KDEs, which are not data element, but rather are key design elements. That is to say, they encode the crucial methodological parameters of your study, and you can recognize them because they appear italicized in the CRF. Now, the case report form for therapeutic interventions starts with fields that every study in this space should complete, and they relate to patient information and general study information. Then, you should complete whichever portion of the CRF best matches the study you're conducting. Meaning, if you're doing a behavioral intervention, then you should complete the portion of the CRF for behavioral interventions. If your study is evaluating a novel pharmacological intervention, you should complete the drug intervention portion. And if your study is assessing a device, then you should complete the device interventions. And of course, you can complete any mix of these portions, however is most relevant to your study. See, by aligning data and design reporting, new studies in this space will be conducted and reported in a more systematic way, which makes it easier to compare them and to aggregate the results. And this will make the impact of your results last well beyond your own publication. So good luck with your next study on therapeutic interventions for disorders of consciousness. I look forward to reading it.